whatever it is that you want, that's your combination, right? But we're going to just kind of tell you what is what are the most common combinations that moms are asking us for. So what would you say is like the number one, Smita?
Hi everyone, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. We are continuing our series on mommy makeovers this week. I'm Dr. Smita, board certified plastic surgeon in New Jersey, and I've got Ashley with me, Dr. Amalfi up in Rochester. Hi Ash.
Hi Smita, I'm excited. Mommy
So
makeover.
am I. Mommy makeovers. This is a very popular procedure, so we are going to dive deep into what it is and pretty much answer any question you might have. And this week, we're going to be talking about what are the most common combinations that we see for a mommy makeover. And I think our practices are pretty similar, right, Ash? So we probably are seeing the same things.
Yeah. I mean, and the answer is like, there's no right or wrong. Just because these are some of the more common ones doesn't mean that that's all there is. Like, this is so customizable that whatever it is that you want, that's your combination, right? But we're going to just kind of tell you what is what are the most common combinations that moms are asking us for. So what would you say is like the number one, Smita?
I mean, I think definitely the most common in my practice anyway is augmentation mastopexy. So that's a breast lift with the addition of an implant, and then a tummy tuck with a little bit of liposuction and the love handles and flanks. How about you?
Yeah, you nailed it. I mean, and that makes sense because it addresses all of the things that are most commonly changed with pregnancy. The implant fills you back up where you lose volume. The lift lifts everything to where it used to be. The tummy tuck, we know the belly is so stretched out, puts everything back in tight. And then as moms, when we carry our babies in the front, we usually get a little bit of fat deposited on the lower back in like that love handle area. And so contouring that with liposuction for almost all of my tummy tucks is just like that little icing on the cake. So you nailed it. Like that's for sure the most common combination. And then we see variations of that, right? With the breast, because some people, I mean, I would say the next most common I see is either a lift or a lift with a small reduction, and then a tummy tuck and lipo. So a lot of people their breasts will get bigger with pregnancy, or their weight changes after pregnancy, and then they just want to be a little smaller, but they have enough of their own volume that they don't need that implant part, right? So they're getting the lift or the reduction, and then the tummy tuck and lipo on the bottom. Is that kind of your second?
Absolutely. I mean, and I think just in general, right? Most people need some sort of lift, right? The majority of people are going to, whether it's a lift in combination with a little bit of a reduction, which, obviously a breast reduction involves a lift by nature of what the surgery is, and then, or a lift with a little bit more volume, whether it's an implant or even fat transfer, right? We can take some of that fat that we have with liposuction and we can inject into the breast if you just want a little bit of a boost. But the main thing, right, with pregnancy, with breastfeeding, your breasts get large. And oftentimes when, that whole phase is over, you kind of have this like loose stretched out skin. So the lift is really most common in combination with something else, right? It's
in a larger breast, it's really, you can't avoid it. And I know no one is excited about a lift, but the lifted breast looks so gorgeous that I think patients are just like really happy with those results, even though no one goes into pregnancy like, wow, I hope I need a breast lift. But they look so beautiful.
They look really great.
That people are just really excited about their outcomes. And then I would say the minority of patients are very small breasted, or they get even smaller breasted after breastfeeding. And those patients, the combination that we see there is that they need the volume. So they need just an implant alone, and then the tummy tuck. And then sometimes those are our really thin patients who really don't have problem areas for liposuction, but sometimes they do. Sometimes even the thinnest patients will have a little bit on that. That iliac region, but not always. And so I would say one of the next most common.
Right. I would agree with you. And I think also, I mean, even taking it to sort of the next level of like what's even less common than that, especially for the abdomen. Do you do a lot of mini tummy tucks?
I do some.
Yeah, so very few, but often, like sometimes there are women that really just have a little bit of loose skin just at the bottom. The remainder of their abdomen looks good. Their muscles haven't really spread too much, but they just have a little bit of loose skin. And that's really going to be the perfect person who may not need a full tummy tuck, but, could benefit from just removal of little skin through a mini tummy tuck. But the incisions are essentially the same minus the belly button incision.
Yeah. Yeah. And that's why this is also personalized, because it's hard to, talk to someone over the phone and say, oh, you're a candidate for a mini, or you just need a lift, or you need an implant. We'll examine you, kind of look at your tissue and help you, come to a decision about what the right plan would be for you. That's why it's important not to get too hung up on exactly what it is that you want procedure wise beforehand. Just come in with an open mind, educate yourself, but let us look at you and help you get to that goal. That's why it's so important to see a board certified plastic surgeon, so you get a plan that's personalized but safe. And then it doesn't matter what the combinations are that's out there, because whatever it is for you is the perfect procedure and the combination for you.
Absolutely. That's so perfectly said. But yes, I mean, you need to go to a board certified plastic surgeon for this. You want to go to someone who truly understands the changes that occur and really is an expert in all of these procedures. So they're really able to offer you the right combination to help you meet your goals.
We'll get you there.
Yes. All right, guys. Well, it was another fun episode, Ash. Love these. We'll see you guys next week on Lipstick and Lipo.
See you soon.